Sleep apnea is a disorder where the airway collapses at night. It's kind of like putting a straw in a milkshake that's too thick. When the airway collapses, we stop breathing and our oxygen level comes down. This causes us to wake up a little bit from maybe stage 3 to stage 2 sleep, but not fully awake where we know what's going on. This causes us to wake up and not feel rested like we should be. Sleep apnea causes other health disorders from stopping breathing at night. Sleep apnea also leads to obesity in several ways. First of all, the chemicals that make us hungry, leptin and ghrelin, are changed. Also, when people are tired, they eat to stay awake, but also they don't move as much and exercise as much, so there's a tendency to gain weight. We also see sleep apnea in children, more commonly related to big tonsils and adenoids, but sometimes can be related to small jaws. Untreated can cause multiple health disorders, particularly premature death. And the death rate from untreated sleep apnea is 30% in 10 years, most commonly from heart attacks, strokes, and auto accidents. The way sleep apnea is diagnosed is we start with history, a questionnaire may be used, and physical examination. And typically what we find is bigger tonsils, uvulas, and tongues, and relatively small sizes of the mouth. The way this is figured out is patients go through a sleep study, most commonly done in a sleep lab. What happens there is you go to the sleep lab in the evening when you normally sleep. They hook wires and pads up to you to measure your sleep. And what they measure for is, do you stop breathing? How often do you stop breathing? How low does your oxygen go? What stages of sleep are you in? If you stop breathing more than 15 times an hour or 100 times a night, we typically treat that. The first treatment that is recommended is called CPAP, or continuous positive airway pressure. At times, some insurances are requiring patients to have home sleep studies before going to the sleep lab. These studies are okay if you have moderate or severe apnea, but if you have very mild apnea, it may not be able to record that. So when patients have sleep apnea diagnosed, CPAP or PAP therapy is the first line of treatment. And to do that, typically patients go back in the sleep lab, they get fitted with a mask, and the pressure is set while they're sleeping. 80% of the people love their CPAP and 20% have issues with it. But patients often need help to achieve that 80% success rate. It's important to make sure their mask is fitting right. Sometimes they need psychological help if they're claustrophobic, or to get used to having a mask on their face. Different things that can be done to help with fit, including cloth liners called Remsies, which can help with mask fit. Heated tubings are sometimes used to help people get more humidity, or if they feel the breathing in air is cold. At times, patients may need multiple masks to make their sleep apnea work. So if you're wearing CPAP and you get a sore spot from a mask, you might need to use a different mask till that part heals up. Another common problem in sleep apnea patients is they will take their mask off in the middle of the night. And this is common when the nose gets stuffy. In those patients, they may need an alternate mask, or we may have to treat their stuffy nose with medicines or surgery to make it that they can keep their mask on during the night. Other issues that come to play with sleep apnea is this is a device that goes in the bedroom, and it's important to discuss with your spouse for a new CPAP user about issues with intimacy. Most spouses find that having a CPAP in the bedroom is much quieter than the spouse's snoring, and when people sleep better, their interest in their relationships and sexuality is generally markedly improved. Repeat testing for sleep apnea is typically recommended when your symptoms recur or if there's been a 20% change in body weight up or down.